Guys, welcome back to Medical Coding with Blue. So it is Q&A Tuesday, Wednesday edition. Now, I did not get a whole lot of questions this Q&A Tuesday batch of questions because I think it's because of the holiday and stuff. So it's totally okay. I'm going to talk about some of those questions and just kind of catch you guys up on what's been going on with me. So this past weekend has been spent doing preparation for my trip. I leave next Saturday and I'll be in Chicago. One other thing, I realized I won't be doing Quiz Friday this coming Friday, next Friday, or the Friday after. So it's going to be a little while before we have Quiz Friday again. So it's going to be the last Friday of the month will be our next Quiz Friday. So if you have a particular clinic that you want me to give you questions on, let me know. And again, my quizzes are never official. They are just for practice and just for discussion and talking about coding and getting some more practice time with the book or the encoder, whichever the case may be. So I got new luggages for my trip. I got them over the holiday weekend because they were having a really good sale. So I decided to get 2 new luggages instead of just getting the one big luggage because I think my other luggage that I've had for like a few years, I think it's about had it, but it has tracked a lot of miles on that trip. So the new luggages that I got are really awesome. They're very pretty, and I'll probably be posting a picture of them on Instagram. And if you are familiar with my Instagram, Medical Coding with Blue, I have been posting pictures today of some food that I made for work. Because you all know I like to cook once a month for work, just to sort of have something and bring it in. And to challenge myself, my culinary skills, I like to do that because to me, it's important. It brings people together and, it's good conversation and, who doesn't like good food, So I posted the picture of the taco soup that I made, which was really good. And then I made a cake that is technically called something else. So I will say that it is an SFW, not suitable for work. The title, okay? So I have renamed it Coder Fun Cake. There's a picture of it on Instagram, and if you are familiar with baking, I'm sure you could figure it out. But I didn't want to say, trying to be proper at work. But it's a very popular cake. Everybody loves it. And I always call it Coder Fun Cake when I'm at work. So, again, to be proper. So anyway, we'll go ahead and start with a couple questions that I did get. So, one of my viewers asked about orthopedics. What were some suggestions that I have about if a coder wants to get into orthopedics? What sort of suggestions do I have? Do I have any advice? So, if you want to get me really happy and excited and nerdy, just ask me about orthopedics and I'm all over it like white on rice. So I love orthopedics. That is like the fastest way to my coding heart is anything having to do with bone work. Okay, so orthopedics and podiatry, I love them. So if you are new to orthopedics or if you are interested in coding for orthopedics, my suggestion to you would be this. Make sure that you understand the bones, okay? Make sure that you understand the muscle groups and what they do. Go to orthoinfo.org. It's one of the websites that I listed on the helpful websites for coders. But I'll go ahead and include the website address down in the description box below. I like that website because it breaks down a lot of like the injuries and, it shows you nice pictures and illustrations. And so it is a very helpful resource. So if you are happen to be coding for that clinic, that is a good resource for you. Get familiar with coding clinics and the fact that they change all the time too with like procedures for orthopedics and just different things. Make sure that you understand those. That's really big. What else? Injury coding. Review the coding ICD-10 guidelines. Okay. on injuries, because that's what's going to help you. Now, when it comes to anything that's going to make me nerd out, that's it, because I really like coding injuries. I like talking about sequela, and I like talking about the different active treatment, subsequent treatment, of course, sequela. To me, if you are new and it's overwhelming you as far as like orthopedics goes, I think the part that overwhelms people is when they don't know, when they first start out with something. And orthopedics has that way because it is essentially bone work, and you have to know and understand the different rules. There's more rules, I think, for orthopedic coding than in a lot of other specialties. So, like I said, understanding like what active treatment is, what subsequent treatment is, and what sequela is very important. Knowing the difference between pain and an injury is another thing. When you are reviewing documentation and the provider may, sometimes they select their own codes and you have to go in and audit these records, right? So when you do, and sometimes the provider will select pain because the patient comes in and they say they have pain. And then when they're describing it, like in the HPI, they'll say, oh, that this patient came in with pain because they tripped and they fell and they hurt their knee and it's been hurting ever since. Additional workup was done. There was an x-ray of the knee. The knee showed a tissue swelling and possible fracture of the patella. Will continue to monitor and place in a splint. Okay, and the provider may just pick up pain. Well, in that case, it's not pain, it's an injury. And a good and well-trained coder will understand what the provider is saying, because he literally said the patient arrived with pain. They fell. So immediately when you hear something happen to the patient, that should trigger you to look for an injury. An injury is anything that happens to the patient, okay? When there's something organic like pain, that means the body is doing this to the patient. Something is aching, something hurts. It could mean if they were not injured, if nobody hit them, if they didn't hit themselves, if they didn't fall or anything like that, this could be the body signaling that something is wrong internally in the body and they need to figure out what it is, okay? That is completely different from an injury, okay? And it should always be coded appropriately. If you are not sure and it is not clear what's going on, then you have to query the provider. But in this case, the provider, this little scenario I just said, it says that it's possible that the patient has a fracture, but they don't know yet. There's always unspecified injury of codes, okay? It's very important to review the musculoskeletal section of the ICD-10 book. Review it. Look at the codes that are available. And when you see like unspecified injury of the patella, okay, in this instance, because there's a possible fracture, and if you're coding for the outpatient side of the house, you can't pick up anything that is ambiguous or unsure. So possible is one of those ambiguous words where, we don't know for sure. So if that is the case, then you want to make sure that you put unspecified, unless the provider says that they specifically have this injury or that injury, okay? So, again, if you are, and I've said this in other videos as well, if you are in a facility where they just sort of like put you in a clinic and then just let you go, and some people get panicked because they say, well, there's nobody there to train me. See, with medical coding, a lot of it is you work on your own, you work independently. That's what I like about being a medical coder. I don't like having a supervisor on my shoulder looking constantly at what I'm doing and making sure that I'm working and things like that. I like that I don't have to have that. my supervisor does have to, I do have to let her know if I'm going to do something. But for the most part, she's not physically behind me watching what I'm doing to make sure that I'm working. She has her way of running reports and seeing what I'm doing all day, and that's fine. I don't have anything to hide, because every hour that I'm at work is accounted for, but be able to work independently. And if you don't understand something, ask questions. That is like the biggest thing. And before the comments, when I say ask questions, okay, and just say, for instance, you're in a place where you are not comfortable asking questions to other coders. And it happens, sometimes, as one viewer mentioned, sometimes other coders can be mean to other coders. And I mean, for whatever reason, if somebody asks me a question, I'm all about helping them. But that's me. I like to help people. And I like medical coding. I mean, I don't mind answering specific questions. I've always said that, the more specific the question, the better, because to me, although I'm not a certified educator or anything like that, I have done so much research on best techniques for educating, especially adults. Children is one thing, because you can tell a child, or hopefully you can be able to tell a child to, listen, sit and listen, and you're an adult, so most times children should, sit and listen to a teacher. Adults is different. Adults have a lot more things going on, and if they don't want to listen, they don't have to. You know what I mean? So there's nobody forcing them to listen, unless somebody else above them is telling them, hey, you better listen. If that, if you are, like I said, if you're in an area that you don't feel comfortable, I would hope that you would look for other resources. And if you have come to my channel as a resource to ask questions, and to ask questions with no judgment. I mean, that's why I'm here. I don't judge people's questions, okay? If you have a question, it does not matter to me. If you think that the question is, oh, this is a silly question, there's no such thing as a silly question to me. Okay. And if I don't know the answer, certainly I will try to help you find an answer. But that's just me. And I think that I'm just doing my part to help, other coders, because that's what I do. And of course, like I said, no one trained me. This is all self-training, and to be honest, aside from just, sitting there with a proctored self-paced program at the school that I trained for medical coding, I really have taught myself how to be a medical coder. And like I said, it's something that I love. I've said this on so many of my other videos. I really do love my profession, and it's not just a job to me. And this is why I spend so much time outside of work, either working on my channel now, or educating myself, or taking the time to go to conference, and spending the money to go, because like I said, my facility does not pay for me to go. I pay for myself to go. And the reason that I pay for myself to go is because investing in myself to be as educated as I can with the latest and greatest is important to me. And when you have something like how I have with medical coding, when you feel like that about your profession or about your work, you'll make the time, or you'll make a way to do whatever you have to get further. I do have to work on my speed, with looking through the book. Because of course, when you sit for additional certification exams, or when you sit for, other tests, you have to be able to use your book, your coding books, and you have to be able to use them quick. Now, I'm quick with the encoder. I have no problem with that. But when it comes to the book is when I start to slow down, and I'm like, oh, so that's just something that I'm working on, and I'm actively working on that now. So doing these quizzes with you guys has really helped me, because I do go through the book when I have to look for the answers. I do sometimes go through the encoder to get the answers, but I do notice that when I go through the encoder, I make mistakes too. So it's just like, oh well. But yeah, so that was it for that question. So that's my advice, is to do all the research that you can and go to these websites. I actively read the New England Journal of Medicine. I've mentioned that before. I recently subscribed to them. So I used to just buy, like, just their magazines by itself. But now, I subscribe to them, and it's great. I like reading it. And even though sometimes it has nothing to do with orthopedics, sometimes it'll have something to do with pulmonary or neurology or whatever, it's still good for me anyway, because I still code for those clinics. And if forever a time comes that I start working with cardio, I'll be prepared, because there's lots of articles in there too about cardio. So that's my advice on that one. Another question was about sequencing. So I've done one other video, and I think that when I do start up with Quiz Friday again, I think I want to start doing the scenario ones, where I can just sort of give you guys a little quick scenario, and then just have you guys, give the order of how the diagnoses should go. When you've had more practice, because a lot of times, like when you're in school and you're working with the book and things like that, it's giving you like one scenario type questions, and of course I've been doing that with you guys, on Quiz Friday, and again, that's totally okay. But I think that if working to build those sequencing skills would help you guys, then I'm all for it. Because in the beginning, I used to have that same question too. And it wasn't really an issue before, until I got to my current facility, where it was just like, okay, well, because when my supervisor was going through, and she was like, oh yeah, you should have put this code first, and then this code, and this code, and this code. And I'm like, how do you know that? How did she figure that out? So we sat down, and she was showing me, and I was like, that makes a lot of sense. So we can go over some of those things, and I think, doing a video about something like that would be really good. So that's another thing that we will be working on. So yes, but yes, we will be doing sequencing. So my advice to you, if you are out there and you're either a student or you're new to the field and you feel like you're getting overwhelmed, like if you're looking at documentation and you just don't know where to start, my best advice to you is look at the reason the patient came in, or look at the reason for the visit. Okay, whatever the reason for the visit, that's where you're going to start. Okay, and a lot of times what the provider is putting in the HPI, or in the beginning part, in the history part, and then they're carrying it down to the assessment and plan, and their final decision making is in that assessment and plan. That's where you want to look at as well. You're going to, of course, look at documentation as a whole, okay? And look and see whatever is pertinent to this encounter. What did the provider address during this encounter? Now, I will say this also. Certain facilities have different rules about like long-term chronic conditions, okay? They have rules about picking up those codes as well. Some will say, well, if it's there, it's in the documentation, pick it up. And there's certain codes that are always code, like hypertension, things like that, diabetes. Others will say, if they didn't address it, if they're not treating it, then you don't pick it up. But again, so it does affect which facility, that you're at, as far as like what you're picking up. But for the purposes of just illustration, we can go through those. But it's going to take some time, because I would have to be the one to write them out and make sure that they're put in a way that it's going to be understandable for you guys, as well as just help you to run down through sequencing and knowing what to look for. What are you looking for? But again, my advice for anybody that's getting overwhelmed with looking at documentation on an encounter or in a record, look at the reason that they're there and start there. What is the reason that they came in for? If they came in with a cough, and in the history it says that the patient has a cough that's been going on for 5 days and they've taken everything for it, and now the coughing is just getting worse and it's keeping them up at night, and in the assessment and plan they say that the patient has bronchitis. Obviously you're not going to pick up cough, because cough is a symptom of bronchitis. So all of that he was describing, and of course he's going through all his tests and maybe reviewing some radiology, and then he decides that the patient has bronchitis. You would pick up the bronchitis, because that's the reason that they came in. Yes, they came in with a cough, but the final result, the final diagnosis is that bronchitis. Okay, then you wouldn't pick up cough in an outpatient setting. Okay, just want to make sure that's clear. I have more experience coding outpatient. That has been 100% of my career, is coding outpatient. Inpatient has a different set of rules. It's a lot different from the professional services. So that's why I say. So anyway, getting long-winded, and I don't want to make this too long, because I'll just keep on blathering about coding. So if you guys have any questions, I will be working on some scenarios for you guys. I won't be filming on Friday because I will be busy assembling wedding cake. And again, it's not for me, it's for a lovely couple that is celebrating their 50th wedding anniversary on Saturday. I'm so excited for them. That's so beautiful to see, like, a couple that's lasted so long, and gosh, that's so beautiful. It's a wonderful thing. So I'm very happy for them. And yes. So I will go ahead and close this out. I hope you all have had a great day. If you are on the Atlantic coast, I hope you guys are safe out there with this horrible weather. And I hope everything gets back to normal soon. All right. I will see y'all for tomorrow's episode. Bye. Oh, and if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. All right. I will see y'all on the next episode. Bye.